If periodontal disease is to be treated without surgery, there must be a way to convert the infected, inflamed, anaerobic, highly oxidized, and acidic environment of the pocket into a healthy place. This is not to physically eliminate the pocket, but to make it aerobic, non-inflamed, and free of infection so the tissues can heal. This ideal led to the next major advance in non-surgical periodontics with the career of Paul H. Keyes, DDS. Dr. Keyes received his dental degree from the University of Pennsylvania in 1941 and embarked on an illustrious career in dentistry and dental research. He served a long term as dental director of the U.S. National Institutes of Dental Research from 1954 through 1980. Dr. Keyes brought a new biologically oriented perspective to the surgically focused dental profession. He formulated a comprehensive multi-stage protocol for his anti-infective treatments that have come to be known as the Keyes method. Even though the method was developed in the 1950s and 60s, it remains the backbone of anti-infective, non-surgical, hygiene-based periodontal treatment today.
The Keyes method can be summed up with this quote from Dr. Keyes that was published in the New York Times in 1982. Quote, "Periodontists talk about eliminating anatomical defects and monitoring the results of therapy with probes. We eliminate the bacterial risk factors and monitor the results microscopically. How else can you know if you've controlled the infection?" End quote. Source for this is Brody J.E., Non-Surgical Therapy for Gum Spurs Wide Debate, New York Times, March 23, 1982, available from this website. So what exactly does the Keyes method involve? We'll offer an overview by including direct quotes from Dr. Keyes, followed up with our IAOMT commentary in italics. The Keyes method states, quote, "Evaluations of tissue damage are supplemented with microscopic assessments of periodontal disease-associated microorganisms, also called PDAM, and the presence of white blood cells." End quote. The source for this is Keyes Ph. et al., A Rationale for Management of Periodontal Diseases, Rapid Identification of Microbial Therapeutic Targets with Phase Contrast Microscopy. The Journal of the American Dental Association, 1983. See also Dr. Paul H. Keyes' website at www.paulhkeyes.com/method. Our commentary is that the use of phase contrast microscopy provides an excellent real-time screening tool for risk assessment of periodontal disease. Additionally, patients can view the microscopic pathogens and be educated about their condition and motivated to take an active role in the treatment plan, which includes at-home measures. Patient education. The Keyes method states, quote, "Patients are informed about the nature of periodontal infections, specific bacterial risk factors, how tissue damage occurs, and the possibility of transmission of organisms from person to person." End quote. The source for this is at Dr. Paul H. Keyes' website, www.paulhkeyes.com/method. Our commentary is that this essential point is far too often overlooked. Periodontal pathogens are transmissible, and it is strongly recommended that patients encourage their relationship partners to get their oral plaque examined and treated if necessary. Patients should also understand that dogs and cats are subject to periodontal disease too. Pocket disinfection. The Keyes method states, quote, "Treatment includes meticulous debridement of root surfaces, 1 to 10 hours, and irrigations with antiseptic agents to the depths of all pockets." End quote. The source for this is Dr. Paul H. Keyes' website, www.paulhkeyes.com/method. We must recognize that many of the oral pathogens lead a double life, in the plaque and in the bloodstream. Our therapy must not force them from the sulcus into circulation, so disinfection comes before debridement. Gross debridement is done just enough to get access to the sulcus. The key to anti-infective therapy is look, disinfect, look again. Repeated monitoring using the microscope during hygiene appointments is essential to confirming the success of disinfection. Even the most skilled hygienist has at times been frustrated to see how resistant some species of pathogens are to disinfection. A quadrant approach does not work for disinfection, as convenient as it may be for debridement. The pathogens will simply spread from the untreated areas back to the quadrant that was treated. The whole mouth must be disinfected at each appointment, and our concepts of scheduling should be modified accordingly. Pocket disinfection is accomplished using a professional pump irrigator with a needle cannula or with the irrigation function of an ultrasonic device, or both. Disinfecting solutions can be diluted hypochlorite, chloramine T, molecular iodine, ozone-saturated water, etc. The more important factor is get another sample, make a new slide, and check to see how thoroughly disinfected the sites are. Patient home care. The Kai's method states, quote, "For the first time in dentistry, quality of home care is measurable by using a microscope. The word clean has a new definition," end quote. The source for this is Dr. Paul H. Kai's website, www.paulhkais.com/method. Quote, "Patients are instructed in an effective self-care program using instruments and agents that combat PDAM, which is the periodontal disease-associated microorganisms. We suggest the toothbrush be used with 10 to 12 brushfuls of baking soda and peroxyl. Compliance in home care is an absolute must," end quote. There are so many instruments available for good home care in addition to the traditional Bass brush and floss, electric and sonic toothbrushes, interdental brushes, and pump irrigators that are adapted for patients to learn how to do deep pocket irrigation daily with a biocompatible disinfecting solution. Monitoring. The Kai's method states, quote, "After an appropriate interval, the patient's progress is assessed by monitoring subgingival microorganisms and the prevalence of white blood cells," end quote. The source for this is Dr. Paul H. Kai's website at www.paulhkais.com/method. The life cycle of these organisms is well known. A decimated population of spirochetes, for example, will take about 10 weeks to reestablish sufficient numbers to again cause disease. We recommend no more than 3 months between visits to monitor those subgingival flora under the microscope. Modulation of therapy. The Kai's method states, quote, "If disease-related microbial complexes have not been converted to ones associated with health, also called bacterial conversion, and if white blood cell levels remain high, in-office treatments and self-care programs need to be modulated. Additional agents and delivery systems should be considered, like custom-fit delivery trays," end quote. Source for this is Dr. Paul H. Kai's website at www.paulhkais.com/method. Systemic antibiotics are sometimes considered necessary by the practitioner to clear the infection. Systemic treatment is more likely necessary if amoebas are seen on the slides. Maintenance. The Kai's method states, quote, "The frequency of maintenance or recall visits will depend on such factors as patient's age, immune system response, diet, smoking, general health, compliance with home care, dexterity, chances of reinfection, the extent of prior tissue damage, etc." End quote. The source for this is Dr. Paul H. Kai's website, www.paulhkais.com/method. The frequency of maintenance visits, again, will also depend upon the life cycle of the organisms involved and visual microscopic confirmation that the patient has been successful in controlling their return.
Dr. Kais emphasized the use of a phase contrast microscope to diagnose the infective load and to monitor the progress of treatment. Pathogens can be characterized. We can see the various bacterial, fungal, and parasitic forms. When it's hooked up to a video monitor, the microscopic view of loads of microbes or their successful elimination can serve as a powerful motivator for the patient. In a typical long treatment appointment, samples might be taken 7 or 8 times for viewing under the microscope. This yields information on microbial organization and the presence of white blood cells, provides instant confirmation that disinfection is complete on that day.